Everyone in Parliament would agree that no Australian health worker should die due to a shortage of personal protective equipment. There are still reports that hospitals, GPs and pharmacies are struggling to cope with a shortage of personal protective equipment. Could the Prime Minister please update the House on when these shortages will be fixed?
The Prime Minister has to call.
Well, I thank the Shadow Minister for Health for his question, and I'll ask the Minister for Health to provide a more detailed response. This has been one of the key focuses of the government now over some period of time, and we've been able to secure significant supplies, particularly in recent days and weeks, and I want to thank all of those who have been involved, whether from industry or government directly, in securing those supplies from a large many sources. We've also been working now over many weeks to increase our own domestic production capability of that same equipment. It is important for all the reasons that the member has said, and I'll ask the Minister for Health to further update the House.
The Minister for Health.
Thank you very much, Mr Speaker, and I want to acknowledge the member for McMahon for his question. One of the highest priorities of this government has been to ensure continued supply of personal protective equipment in what has been an intensely competitive global environment. We've seen the shortages and the suffering not just of health workers but in relation to the broader population, whether it's in Europe or North America, whether it's in parts of Asia or elsewhere. Against that background, we've been determined to continue through both domestic production and international procurement the supplies of personal protective equipment. That's included the distribution of 11 million masks to date, which includes 2.5 million to primary healthcare networks to support GPs, community pharmacies and Aboriginal and community-controlled health organisations, more than 1 million masks to support those who are assisting in frontline activities, and then 6 million masks to state and territory health departments to support the acute care sector, in particular hospitals. We have also, as part of our procurement program, now landed over 30 million masks in Australia. This has been a difficult and challenging task. That is part of a broader order process of 500 million masks. As a consequence, we are now allocating a second round of 11 million masks, and shortly before question time I announced that that would include 7 million for states and territories for their frontline public hospitals, 2.3 million to primary health networks, including 1.5 million for GPs, 500,000 for community pharmacies, 75,000 for Indigenous workforce and healthcare, and 160,000 for respiratory clinics, and 1.7 million masks for our aged care workers. So we'll continue to provide those masks. We are now getting ahead of the curve on this front, but we are very mindful of international supply constraints, and I want to thank our healthcare workers. They are literally saving lives and protecting lives, and we will do everything we can to support them and to protect them.